Off against the flu can make a world of difference in the battle of the bug.
Hospitals are on the front lines, and as Dr. Peter Ostro reports, healthcare facilities are very busy as this virus spreads.
If you've been to an emergency room lately, you probably had to wait longer than usual to be seen, and that's largely because of influenza.
We've really seen an intense number of cases of flu-like illness over the past month.
Dr. Michael Manka is Chief of Emergency Services at Erie County Medical Center. He's seen that here, as in the rest of the country, the flu season hit early.
I think that this influenza seems to be hitting a lot more patients than what we typically see this time of the year.
The vast majority of people who have influenza don't need hospital care.
Most patients are staying home and drinking fluids and taking Tylenol and riding it out, but we're seeing the patients who feel that they need to be evaluated in the hospital. Particularly those with other medical conditions like asthma or emphysema. Those patients need to be aware of their symptoms getting worse. And the thing we remind people is if they start to feel short of breath, they feel winded, out of breath, even just at rest, they should really be seen by their doctor or in the emergency department.
Vaccination is the best way to protect yourself. It only takes 2 weeks to become effective, so there's still time to get a shot for this flu season. Sometimes people complain that they got vaccinated, but they still got the flu.
Yeah, we hear that a lot, and that's because there's other viruses causing the same symptoms. So even though they come in with flu-like illness, it may be another respiratory virus or an intestinal virus that is causing them to have fever and similar symptoms.
You can't avoid all those viruses, but the flu vaccine works against influenza. If you haven't had a shot this year, get one. For News 4, I'm Dr. Peter Ostro of the UB Medical School.